Here's a brief talk to tell you a bit about ourselves in Oxford and how we fit into the rest of the university, and to show how our group works and oversees the running of this trial from Oxford. I expect many of you may have visited Oxford, and even if you haven't, you've probably seen pictures of the famous university. We're extremely lucky to have this beautiful city with amazing historic buildings around us and a lot of really very impressive facilities. Indeed, Oxford is well known for its medical research, and there are a lot of really strong groups here in Oxford that do research in lots of different areas. This is our building, which you can see is a little different from the typical Oxford buildings, and is much more modern than many university buildings in the city centre. We're slightly away from the centre of the city, and this was a purpose-built facility for us, where we have office space and, importantly, laboratory space, where we have dedicated laboratories that receive the blood samples from the trial, including your blood, and indeed samples from many other studies. There's a separate video that you can watch on the trial website, which shows you just what happens to your blood samples when they arrive in our laboratory. In terms of how our research group fits into the university, overall, the university is divided into what are called divisions. And as you might expect, our group is in the division of medical sciences. We're based in a department called the Nuffield Department of Population Health, also known as Oxford Population Health. It's a relatively new department by Oxford standards, as it was only established in 2013, with Professor Sir Rory Collins as the first head of department. Our department sits alongside another 15 under that umbrella of medical sciences. And within Oxford Population Health, our trials group is called CTSU, which stands for the Clinical Trial Service Unit. And this is where the Orion 4 Coordinating Centre sits. There are a number of other units based within the department that all have a shared interest in research in population health. And what the department does is that it brings together research groups within the university who are all working on population health, particularly those that are focusing on major causes of death and disability around the world, of which perhaps the two biggest interests are cardiovascular disease and cancer. We obviously do research directly, so trials like Orion 4 and other clinical trials, but also other types of research, such as studies trying to understand the causes of disease. As well as that, we also do a lot of training and career development so that we can develop the next generation of population health scientists. And overall, the aim of our work is to answer important questions about the causes, prevention, and treatment of common diseases. As far as our trials work goes, the focus is particularly on cardiovascular disease. That's the heart attacks and strokes that the Orion 4 study is looking at, but also cancer, diabetes, kidney disease, and more recently COVID-19. Indeed, our department ran a trial called the Recovery Trial, which you may well have heard about on the news during the pandemic. It was the biggest trial in COVID-19 and probably one of the most important studies during the pandemic. And within just a few months of the start of the pandemic, the Recovery Trial started to produce results which showed us which medicines should be used and which medicines shouldn't be used for people with COVID-19 who'd been hospitalised with the disease. Estimates are that that trial alone probably saved about 1 million lives during the COVID-19 pandemic. So you can see how important these sorts of medical research trials can be. And indeed, Orion 4 is also likely to be a very important trial in terms of its potential for helping population health in the future, both for the UK, but actually worldwide. Here's a picture of just some of our team in Oxford who work on the study. We have a really wide range of people working in the department here, helping to make the trial the success that it is. We've got trial administrators and trial managers. We have computer programmers, laboratory staff, statisticians, doctors and nurses. There are trial monitors, some of whom you may have met during your clinic visit. They come out and visit the sites and support the nurses out at the sites with running the trial. We have IT testers, and then we have the call centre. And again, some of you may have spoken to some of our call centre staff. If you have queries or if you need to change your appointments, then you get through to a member of the team, again, based in our department here in Oxford. So a huge thanks to all of the team for making the trial work, and of course a huge thanks to all of you who volunteered to join the trial, without whom it definitely wouldn't work.